Precision medicine requires precision diagnostics. Precision diagnostic is very important in patient dealing with cancers. Genomic Testing Cooperative, or GTC, is very unique because it is based on cooperative business model. Cooperative business models mean different laboratories can collaborate and work together, and this is what's unique about GTC. The co-op model works through two models. One for small laboratories where they send us the sample and we perform the testings. The second model for larger laboratories, large practice hematology groups or oncology groups, or larger hospitals where we establish a wet lab in their facilities and we perform the analytical part on the testing when it is done in their facilities. Cost effectiveness in our work is achieved through two ways. First, by having cooperative groups, our volume is high, therefore our cost is lower. In next-gen sequencing, economy of scale is very important. The second way for reducing cost is by implementing algorithm softwares based on deep learning and artificial intelligence in analyzing the data generated from our next-gen sequencing and interpreting the data generated from our next-gen sequencing. We are using artificial intelligence in analyzing the next-gen sequencing data, as well as in developing models for classification of diseases and subclassification of diseases, as well as for predicting outcomes and therapy. Our business model is very disruptive to the business of next-gen sequencing and diagnostics. We are the first laboratory that is based on cooperations rather than on competing between different laboratories. This is a unique and disruptive approach never done before, to have different laboratories working together to offer better science and better innovation for the patients and for the health system as a whole. Our reports are very comprehensive. It includes complete analysis of the data, explanation about the biological abnormalities. We provide diagnosis as well as classifications. We also provide recommendations for therapeutic approaches based on the findings. We also provide a list of clinical trials that might be dependent on the findings of the abnormalities in the patients, as well as overall summary for our test. We are unique by being complementary to the community-based laboratories. Smaller laboratories cannot afford, or it is not practical to establish next-gen sequencing facilities with sophisticated instrumentations as well as computers and scientists and expertise. We complement them by providing all this as extension for them and work with them and listen to their needs, educate them, and help the local physicians. The business model of GTC is very amenable and very useful for setting up companion testing based on LDT, because with the co-op model we can disseminate the technology by doing cross-validation between different laboratories who belong to the memberships of the co-op. And that will allow multiple laboratories to offer the LDT test if it is companion testing with similar standardizations and similar quality.